As I was explaining, I'm a clinical scientist. I've been working in the NHS now for just over 20 years. I love my job, and I currently work in the UK Anaerobe Reference Unit, which I'll describe a little bit more about that in a moment. This unit is a UK specialist laboratory that resides within Public Health Wales, which is a network of laboratories and healthcare professionals here in Wales to help protect the nation from infection and from other things that would harm us. I'm going to talk today about this particular topic of C. difficile, but it's important to remember that Public Health Wales protects us from all sorts of things on a day-to-day basis, but also, as you can see there, I was involved with some work that we did during the 2012 Olympics, during the NATO summit in 2014, and also the Champions League final. So Public Health Wales gets about a bit. Next slide, please, Claire. So the anaerobe reference unit that I work in is based in the University Hospital of Wales here in Cardiff. You'll probably recognise that picture at the top there. An anaerobe is a germ or a bacteria that effectively doesn't like air, and particularly within air, it's the oxygen. And so these organisms basically will have variable tolerance to oxygen. Any oxygen may kill some of these bugs. Others can tolerate a little bit and others a lot. But most of them do not like oxygen and will die. When you think about anaerobes, probably one of the most common things that people might be aware of is halitosis or bad breath. So anaerobes are bugs within your mouth and within your gastrointestinal system, so within your stomach and your bowel, that can be very smelly. So when people come into the anaerobe lab, the first thing that they often say is, "Ooh, it really smells in here." And that's because it does, because these bugs do cause a bit of a smell. As you can see there on the right and at the bottom, we have C. diff actually written on our roads in Cardiff. So it's good that we have a reference laboratory here in Cardiff, because it's obviously the place that it should be. And the pictures that I have there of cows and of my apron that my wife bought me a couple of years ago for Christmas, or should I say Father Christmas bought me, is because I love cows. I grew up on a dairy farm. And interestingly, Clostridioides difficile, which is the bacteria that I'm going to talk about, has a distinctive farmyard or manure smell. So when you grow this on a plate, it is a little bit smelly, but I'm used to that because I grew up on a farm. Next slide, please. So we're just going to take a moment to have a poo tutorial. Now, this is some information that you can find on the Guts UK website, and it's really important that we are aware of our gut health. And on this Guts UK website, which is fantastic, I would highly recommend it. You can basically look at the resources that they have there and assess how healthy or otherwise your gut may be, judging by the sort of poo that you have. So I would highly recommend going on there. When you're looking at poo, there's a few things that are important to consider. One is the color, two is the consistency, and then thirdly is the frequency. So how often you go to the toilet. And all of those things are very, very different for different people. So Clostridioides difficile causes diarrhea, sometimes a very, very severe diarrhea. But diarrhea itself is quite subjective as well, because some people's frequency and consistency of their stool will be maybe a little bit runny, and quite often other people will often pass very formed or solid stools and maybe not go very often. Even as little as 1 week for some people is normal. So the definition of diarrhea can be quite variable. But the diarrhea that I'm going to talk about really is unbearable. So yes, go to that website if you have some time and you're not too squeamish. Next slide, please, Claire. So Clostridioides difficile. I'm going to give you a very quick whistle-stop tour of the history history of C. difficile. So back in 1893, so quite a few years ago, there was a clinical condition that was termed pseudomembranous colitis. Now, colitis is when your bowel, your intestines, are inflamed. So it's an inflammation of your colon, effectively. And pseudomembranous colitis is where this inflammation becomes so severe that it can lead to death. In 1935, then, we had these scientists, Hall and O'Toole, who described a bacteria that they called Bacillus difficilis. And that was because it was a bacteria that was very difficult to grow. Now, this bacteria or bug became known then in later years as C. difficile, so the bug that I'm talking about today. But it wasn't until 1978, which was an excellent year, by the way, vintage year for anyone else born in 1978. In 1978, these conditions of antibiotic-associated diarrhea, or the pseudomembranous colitis, and C. difficile were put together, that they recognized that it was this bug that was causing this clinical condition. Next slide, please. So, who is Clostridioides difficile? So it's a bug that normally lives in the environment. It can be found in soil, in water, and in or on animals. It may also be a part of our gut and not cause any disease at all. So it may be a harmless bystander. In the environment, it forms these seed-like growths that we call spores. You may have heard of fungal spores. Well, bacteria can cause spores as well, and these help the bug to survive within the environment. And what you can see there on the right-hand side at the top is a picture of a agar plate, and that's what we grow these bugs on. And then at the bottom right there, you can see what we call a gram stain. So this is taking the bug off the plate, putting it onto a slide, using some colored dyes effectively to stain the bacteria. And we can see these pictures, and they're quite typical of this organism. You might not be able to see it because it's probably a bit small on your screen, but effectively they're sort of dark purple, and on the end they have a little bulge sometimes, and that bulge is the spore that the bug is forming to then put into the environment so it can continue to survive even in difficult places. The challenge for C. difficile from a clinical and human perspective is that these spores are very resistant to cleaning. And the sort of normal products that we would use in hospitals and homes that are safe and not too harmful, they often don't work. So yeah, it's a bit of a challenge. Next slide, please, Claire. You've probably heard of superbugs. Often we talk about MRSA. You might have heard of that one as a superbug. Well, C. difficile is also a superbug. A superbug is defined as a bug that is quite difficult or very difficult to treat. And C. difficile is one of those. The reason that we get C. difficile is usually because we've been colonized. So we have C. difficile in our gut, and then we have some sort of treatment that disturbs the good bacteria. We have gazillions of bacteria in our bowel, and most of those are there to help us to digest things and to protect our gut from bad bacteria. Unfortunately, if we wipe out those good bacteria or good bugs with antibiotics or with chemotherapy, then the bad bugs can sort of take their place and grow and proliferate and cause us really unpleasant diseases. C. difficile is one of those, and it has toxins, so it excretes, it puts out these things within our guts that make the cells in our guts inflamed and causes a really bad diarrhea. And that can be anything from just a mild, oh, I've got some stomach cramps, to a good going diarrhea, to, as I said previously, this pseudomembranous colitis, or something that's called toxic megacolon, which sounds pretty nasty, which can then lead to death. Next slide, please. And sadly, even in our healthcare system today, people are still dying with C. difficile infection. At the top right there, some of you may be aware of, for the more mature ones in the group, I include myself in that, that back in the early 2000s, we had a lot of problems with Clostridioides difficile. And particularly in the news was a hospital called Stoke Mandeville Hospital, and they had some very large outbreaks there, with a good number of deaths, very sadly. Fortunately, we don't see that picture very often here in the UK anymore. We see very few large outbreaks, and certainly, even when we have outbreaks, we don't have a large number of deaths. And that's because we're much better, we're much more aware now of C. difficile, and we're better at spotting it and treating it. However, it does still lead to mortality. It does still kill people that it really shouldn't. And so it's a very relevant topic still today, sadly. Next slide, please. The relevance has become even greater just recently as well. So after these terrible outbreaks that we saw in the early 2000s, a lot of work was done to reduce the numbers of C. difficile within our hospitals and communities, mostly within our hospitals though. And so what we saw over sort of a period of 10 to 15 years was huge reductions. And you can see there from the graphs on the right, you can see that we've got sort of, rates coming down and down and down and down. And that was the case up until about 2020. Unfortunately, during the pandemic, we did see an increase in our C. difficile rates. And since then, they have been going up and up again. Fortunately, not to the levels that we saw in the early 2000s, but it is a worry that we are seeing these increasing rates. We're not sure why. It may be to do with how healthcare has changed since the pandemic, but we are seeing these increases. And what we haven't seen since the early 2000s is really a huge reduction in our community cases. So we've really done a good job at improving the situation in hospitals. But in the community, we still see not huge numbers, but pretty much very similar numbers that we've seen for the last 10 years. And again, sadly, in some health boards here in Wales, we have seen some very large outbreaks in the last year or two. Fortunately, with not too many deaths, but it is still a very relevant topic. Next slide, please. So the challenges that we have, apart from the numbers with C. diff infection, are that we have limited treatment options. And the challenge with our treatment options is that it's an antibiotic-associated disease, and yet we try to treat it with antibiotics, which kind of sounds a bit silly, doesn't it? And a lot of the antibiotics that we try and treat C. diff with will also kill some of those other good bacteria in our gut. So it's a bit of a struggle. We do have some other treatment options that I'll talk about later, but they're fairly new and still quite expensive. So our standard treatment for C. diff is an antibiotic that also kills other good bugs in our gut. So not ideal. Because of that, we see what we call recurrent infection. So when someone has an episode of C. diff infection, about 1 in 5 people will get another one within the next year or two. Sadly, once you've had an additional episode, so one recurrence, you're then as high as maybe 6 out of 10 people will continue to get other recurrences or further episodes of C. diff diarrhea. And it's just miserable. The life that people lead when they effectively don't have a life. If I had time, I would share some patient stories with you. But it basically, not only does it make them very ill, but it makes their life very, very miserable. They lose huge amounts of weight. They're often bedbound, certainly housebound or hospital bound. And it also affects their families and their confidence afterwards and just everything. Their bowel habit is never the same again. Just terrible. And then add to that, just to throw it into the mix, we also get, because of these spores, because of these seed-like growths in the environment, we also see transmission between patients and from environmental sources, common environmental sources. So it's not a great picture. Next slide, please. From a patient and public perspective, there's very little information available, sadly. And the information that is available, and this isn't just in Wales, this is across the UK and probably the world, the information that is available is often outdated. Because we don't see huge numbers of C. difficile cases in the UK anymore, the awareness amongst members of the public is quite low. And so when someone's given antibiotics and they develop diarrhea, they often think that it's just the antibiotics, because we've all seen the leaflets, haven't we, in antibiotics say, might give you some stomach cramps with a little bit of diarrhea. And so people often think, well, I'm on antibiotics, so my diarrhea is an adverse effect of those antibiotics. Actually, often it can be a C. difficile infection that people aren't aware of until it gets very, very bad. And then it's more difficult to treat and potentially more likely to lead to recurrence. Because again, we don't see a lot of it in the community, our community healthcare professionals, their awareness and exposure to C. diff is quite low. And even within hospitals, doctors, nursings, and cleaning staff are often so overwhelmed with other priorities that C. difficile falls down that list, and patients aren't always treated and managed as well as they should be within our hospitals. Next slide, please, Claire. So what are we doing about it? That's the question, isn't it? And I've got some good news in relation to that. So in 2021, myself and colleagues established what we have called the Wales C. diff Infection Focus Forum. And you can see the acronym there, and I think you can probably see what I've done. But we liked that. And this is a multidisciplinary team of C. diff experts. So you can see there in the heart, we've got all sorts of nurses, doctors, scientists coming together with expertise in C. difficile to sort of do a multi-pronged approach to try and look at C. diff holistically from all the different angles of how we can help to prevent and manage it better. Next slide, please. One of the first things that we did is in C. difficile Awareness Month, as Claire mentioned in November, we held a conference last year, and we got all of the C. diff experts who could attend in Wales to that conference, and we sort of thrashed out those things that we felt were most important. As a result of that conference, we've now put together the Clostridioides difficile strategy and action plan for Wales for the next 2 years. And that's something that we're now pushing ahead with to try and improve the situation here in Wales. We have another conference coming up in early 2024, and if anyone is interested in attending that, please let me know. We would love to have you there. Next slide, please. So the initial priorities of the forum were to improve access to and awareness of recommended treatment options. As I said, the sort of standard and older treatment options are fairly well known, although the older treatment options actually aren't recommended anymore because they're not as good as some of the newer treatment options. We now have an antibiotic that is a lot more specific for C. diff. So when you give someone that antibiotic, it generally acts mostly on C. diff rather than on the rest of the gut bugs. And so that helps then patients to get better and not to have additional episodes. There's also an alternative treatment that's called FMT. Now that is fecal microbiota transplant. Basically, again, apologies to anyone who's squeamish. Basically, you give a healthy person's poo to someone who has C. difficile infection. You either put it down a tube straight into their stomach, or through a colonoscopy, so from the other end, you put it into their gut, and it repopulates their gut with good bacteria. And that has a really, really high success rate, and that's recommended for anyone who's had more than one episode, more than one recurrent episode of C. diff. So we're trying to improve access to that across Wales as well, because as you can see from an article there that I've just referenced, it's estimated that across Europe, and this is almost certainly the case in the UK, only about 10% of people who should get an FMT actually get one. So that's a lot of people not benefiting from a treatment that actually patients really want. Once they've got to the stage that they're at, they're like, I will do anything, even if that means having someone else's poo put into my gut. We're trying to help to increase understanding of community healthcare professionals, and we've put together a healthcare pathway that's going to be published soon for community healthcare professionals. And we're trying to ensure that prevention and management in our hospitals are up there with healthcare professionals' highest priorities. Next slide, please. As I said previously, there is a paucity of patient and carer information and public information, and so we've also produced now some up-to-date information for patients with C. diff and for those at risk of developing it. So anyone who's given antibiotics that are likely to lead to a C. diff infection, anyone who may be thinking about having an FMT, some information for them, and then just anyone who's got an infection, a general leaflet to try and help them to see how they can best look after themselves or look after those that they care for when they have a C. diff infection, and reduce the likelihood of them getting another one. Next slide, please. We're also looking at producing and forming a UK C. difficile trust. So you may have heard of the Sepsis Trust or the Cystic Fibrosis Trust. And these are basically charities that support patients with these conditions. And that's something that we're looking to do as a forum, and working with other UK colleagues to try and make that a UK presence on the internet, and then from there go to producing other resources and helping in other ways. We're also sharing the information leaflets that you saw just previously with other UK nations who are really excited to receive, and also collaborating with other intestinal disease charities such as Guts UK to make these resources available on their websites and have information about C. diff there as well. Next slide, please. So thank you very much. Hopefully that's not been too confusing, too much information to take all in one. I'm very, very happy to take any questions that you might have.